Well, thanks for tuning in. So tell me, how many hours have you spent on your phone today? 1 hour? Maybe 3? Maybe you're even watching us from your phone right now. The truth is, Nigerians on the average spend 5 hours on their screen daily. Our eyes are paying the prices. Headache, blurred vision, dry, tired eyes. If that sounds familiar, you're not alone. It is called digital eye strain, and it's rising fast in Nigeria. So today we are asking, are blue light glasses the answer? Is dark mode saving your eyes or just a trend? And with NEPA, generator, and budget phones, are we making it worse? Well, to break it all down, we have been joined by Dr. Chinawa Ndubisi, a leading ophthalmologist here. So he's here with us to break it all down for us today. Don't go anywhere. I'm sure you're going to gain in much more today from this discussion. Doctor, you're welcome.
Thank you.
I'm glad you had to bring that in, ophthalmologist. All right, so let's go straight to the point. So many people complain a whole lot after going through their phones. They complain of blurry visions, headache, itchy eyes, and all that. Well, in essence, let's ask the question directly. What exactly is a digital eye strain?
Okay, thank you for having me today in your program.
You're welcome, sir.
Okay, digital eye strain is called computer vision syndrome. It's become so common today because of prolonged exposure to electronic devices, computers, smartphone, and the rest of them. So it doesn't happen because when someone uses phone. It happens when there's prolonged exposure to these devices because of the rays that emerge from the phones, the lighting, and the environment that the person uses the phone. So it's the discomfort that comes when someone is exposed to his devices for a long time. And some of those symptoms the person can have, just like you mentioned in the preamble, the person can have symptoms of dry eye, the eye gets red, it gets peppery, and occasionally it gets teary, fatigued, occasionally vision gets blurred, and in some extreme cases, the person begins to have headache and eye strain. The headache located in the temple and all that. So what accentuates is not just the use of the phone, even the environment. How humid is the environment? How is the lighting in the room? Is there a phone shield? The person uses glasses, and then what is the person's health condition and age? These are the factors that affects it from one individual to another.
People talk a whole lot about blue cut glasses and all that. Is it really working, or is it just a trend?
No, it's not really a trend. Blue cut is designed actually for these electronic devices like the computer and the phones, because of the kind of rays that come from it. It's the blue kind of rays.
Okay.
So like a blue block, it stops that, as opposed to photochromic lenses. Photochromic lenses are more effective in ultraviolet rays outside. So it prevents you from sunlight more compared to blue cut. Blue cut does better with devices, but they also have transition lenses that have combination of both. So blue cut is not just a trade issue, it's therapeutic in taking care of this digital eye strain we're talking about today.
Okay, all right.
Yeah.
What about people where their work disposes them to being engaged and having prolonged time?
Yes, it's inevitable. Like, for you guys in the media and the bankers and the rest of it, in fact, most works today tend to use more of system, because of programming. So what we tell them is that if your work is going to demand prolonged stay in the device, you take intermittent break. If it's a work that will take, let's say, 8 hours, a person can accomplish the same thing by taking 2 breaks. After every 2 hours, you take a 15 minutes break and go outside and look at, interact with nature. Some people call it 20-20-20, the method of you come outside after 20 minutes, look at something 20 feet away for like 20 seconds. But the point here is that prolonged duration can be done intermittently, because what happens is that when you are using your device, your blink rate reduces. An average individual blinks like 20 times per minute, but when you are in a device, it's reduced like 5 times. And when the blink rate does reduce, the tear production and distribution is affected, so the eye gets dry and all these symptoms are accentuated. So for people whose job involves prolonged stay in computer, what I advise them to do is time yourself and take intermittent breaks, 1. Number 2, you can put a shield over your computer to limit the light that is making contact with your eye, and then ensure that your chair is comfortable, because we're not talking about just the eye, but the ergonomics of the work. Some people that the chair is not comfortable, you develop neck pain, develop back pain. The environment, there will be AC without humidifier, so the dryness is accentuated. For such people, the primary thing here is that they should take intermittent breaks and interact with nature in between.
Okay. There's this other trend. dark mode and light mode. It's always, most phones now have it. In fact, I see so many persons using, there's this shield they have on their phones that if you're not the one operating the phone, you can't even read from the phone, right?
Yes.
So those things are they really working?
Yes,
Which one is better?
It helps. The eye care mode in the
Okay.
phones, yes. It helps because it limits the light that comes out from the phone. So I skipped it when I was talking. So if your phone has that eye care mode, you put in eye care mode, it also limits the light contact to the eye and limits the tendency for this digital strain.
Okay, why I brought that in is that sometimes when you put that dark mode, you tend to strain. Like me, I tend to strain to read what's on my phone. So is it the strain? Is it better than me having the bright mode?
So what the person can balance it. You put the mode and increase the fonts.
Okay.
So when the font is increased and it's a bit dark, you can still accomplish the same thing. So if you're going to use the eye care mode, you can at the same time increase the fonts in your phone so as it becomes larger for you to read. So yes, if you're using the eye care mode and retaining the same fonts you're using with bright lights, it may be difficult to read. So the using of eye care should be combined with increasing the fonts of your phone, so it makes it easier to read.
All right. So when we are working a longer period on the phone, which one would you suggest is better?
What I would suggest better, number one, is intermittent breaks.
Okay.
It's absolute. Yes, that's intermittent break. Then, in fact, everything should happen together. You know, the intermittent break is there. Using eye care mode is there. Using your blue block glasses is there. Increasing the fonts is there. Of course, if the person is up to 40 years and above or late 30s, at which time he develops presbyopia, realize that you can't see things except you put it at arm's length. So the person ought to be using his presbyopic correction at that time. I mean, by the glass to enhances your reading, because if at that late 30s, 40s and above, the person realizes that the things I used to see comfortably, I'm straining. You know, it means you need to have some eye care evaluation and giving some glasses for it to help your reading. Because if the person, no matter how you adjust your phone care, the lighting of your phone, and they take your breaks, but if you have not had your presbyopic correction, the person will see strain. You know, when we grew up, we interacted more with nature. You know, most of our play then was outdoor plays. We play football, we play, the girls engage in different kind of things. You realize that we developed better. But now parents, in a bid to limit distractions, they can focus. They throw device at these children. So the first adjustment for kids is parents should go back to how it was in the beginning. Children should be made to do more of outdoor activities. Rather than buying devices, you can buy the football, buy them tennis ball, buy them things that can make them interact with nature. Because when they stay long with the device, they are just in their immediate environment. After a long time, they can have induced short-sightedness. The child that's not doing refractive error may eventually require glasses because all his life he has interacted with his immediate environment. And beyond the eye, there's an ongoing study now that shows that for growing on kids between 3 and 5 years, it affects a part of the brain they call the white matter, the intensity of white matter that helps in conduction of signals. And this white matter, they said that for such children, they have challenges with their cognitive function, their literacy, and language processing. In those days, you can see a child that can speak 4 or 5 languages. But now, because of the effects, not just on the eye, but on the brain, so these things are limited and affected. So I will encourage parents that while trying to throw device on the child, is affecting the child's brain to an extent. So you realize the child is not doing well in school. And psychologically, some studies done by psychologists have shown that most of those children, they are highly irritable. So they don't interact with human beings. So a little thing gets them angry. They are in their own world with devices. So when they mix up with others, they tend to be violent because they are highly irritable. That's psychologically in the mind. In the brain's parts, the white matter is affected, cognitive function is low. And in the eye, they have this eye strain. So the best thing is go back to how it was. They should interact more with nature. Then for adults, in addition to what I just said about the intermittent breaks, you know, this is a holistic thing we're talking about here. You know, for someone who is not healthy, will have tendency to have worse case scenario of digital eye strain than a healthy person. So I would advise people, go back to your natural food, your vegetables, your fruits, because when the eye is healthy, it can fight, it can have a better defense to all these things. So those are some of the adjustments we can make.
Now that you mentioned, you want a follow-up question? Or should go
Okay,
ahead?
yes.
Okay, go ahead.
Okay, so I want to ask, before now, before the era of the devices and all of that, people used to, at the age of 40, I know it wasn't so common, kind of squint. Could that be part of the strain, or could it have been another eye defect?
Yes, actually, that squinting at the age of 40, you know, it's been there, like you said. So what happens is that when we are younger, a part of the eye we call the lens was soft. It could change shape. So when you want to read, it changes shape from being spherical to round. You're able to read. But when the person gets that age, that lens part is hardened. It can't change shape. So bring things to focus. So you see the person now reading this way. Okay. So what I tell people, when you notice that is happening, it means they have come to the age that you need reading glasses. There's no need trying, because when the person does that for a long time, over time he develops frontal headache and begins to strain, which poses a challenge to the eye health. So that one is a physiological thing that comes with age. Okay. And some people will now tell me, what of my parents? My father is not reading with glasses. Why am I reading with glasses? You know, the change that happens at about 40 years, it affects reading vision. Distance vision is preserved. When the person gets older to 50, 60, 70, it reverses. The person develops cataracts. He stops seeing far and starts being able to read. They call it second sign of the aged. So you can see old men in church reading hymns without glasses, and you wonder, ask them to point something far, they can see. So it's reversed. So between 40, 35, 40, 45, the person struggles with reading while he's seeing far. Between 50, 60, yes, it reverses. Second side of the aged, the person can't see far, he starts reading. So that answers the question. Many people have asked me this question: why am I using glass? My father is not using glass. He can't see far, you are seeing far.
Okay, so but if you have the issue of not seeing far at your younger self, does it mean when you grow older you'll be able to see far and not see the other way around?
No, it means the person has it. No, it stands to reason. Actually, since they're all reversing. Yeah. Yes. No, it means the person is long-sighted, so he should be corrected.
All right. So this statistic I saw today that the number of people coming down with eye issues now in Nigeria is like growing on a daily. What would you attribute to this growth? You know, with so many Nigerians on TikTok now, we have betting apps all over the phones and all that. Would you associate this with social media and all that?
Absolutely. When I was in training to be a consultant, then what we are taught is dry eye syndrome is a disease of the aged from 60 years and above. Okay. That's what causes that at that age, the tear production is reduced. But when we started practicing eye surgery and medical part of eye, we began to see children with dry eye, digital eye strain. And what caused that is exactly what you just said. Then social media wasn't the end thing, but now the Gen Z, they are always on their phone, TikTok, you know, social media and what have you. So this change in trend is bringing this high level or increase in prevalence of eye problems in Nigeria. So what I would tell your parents is, you know, don't just leave device with your child. Be there. Not just because of the eye thing. There are many other things that they need to be guided while they are online. Yeah. So prolonged exposure because they are not guided, because the child should be timed. Because there's a study that stated for a child less than a year should not even be exposed to the device at all. Once, say between 3 and 5 years, it should be at least an hour a day. Okay. So the parents should be there to monitor the child to see that that time interval is kept, because beyond that, all these problems start, and at times, if it's not controlled on time, it can pose a more serious problem in the future.
Okay. Doctor, let me ask this quick question before we go on break or before Eddie comes in. You know, when the light is flickering, it has this impact. Does it have anything? Does it worsen eye visions? Does it even cause the digital strain eye we are talking about? You know, sometimes NEPA bring light is low, sometimes it's high. Does all this have any effect on the eye? Yes,
it does, because different parts of the eye, the rods and cone, respond to bright and dim lights. So when you are overly stimulating, you get those cells continually acting. And then that's contrasting lights and darkness. In dark, the pupil dilates. In brightness, it constricts. So you are dilating pupil, constricting pupil, dilating pupil, constricting pupil. The person will eventually have temporal headache and straining. So it actually accentuates. That's why one of the things that is said to take care of digital eye strain is when the person is using the device, the room should be well lit to match the lights of the system, the device you're using. So you see many people, young people, they say that I prefer using my phone in a dark room. So what happens now? The room is dark, the pupil is dilated. the phone is bright, the pupil is constricted. So there is a tension in that part of the eye. So that's the same effect you have when the eye is flickering. So the pupil is that it's not constricted. At the end of it, the eye is strained and stretched. So what's the advice is put your system in an ambient light that matches that of the room. You either dim your system to match with the light of the room. But what I tell people is that by all means, if possible, avoid using your system in a dark room. Apart from the issue of the light, when the room is dark and the pupil is dilated, we have fluid in our eye that circulates and flows out in and out. So when it is dilated, the parts where the fluid flows out for it is narrowed. So the fluid begins to accumulate and the pressure of the eye might increase. Yes.
All right, thank you so much, Dr.
I just got carried away with that, and my mind is running through, a lot of things, thinking about the people in the bank and people who uses computers steadily. Though we've talked about the 2020, 2020 method. What other methods can one apply?
Is it even scientifically proven? Because I hear people talk about this 2020. So is it scientifically, or is just?
What I tell people is this, since it's been proven that when you're on your device, your blink rates reduces. And with each blink, there is tear distribution. So when the blink rate reduces, tear distribution is impaired. Dryness increases, distal strain worsens. So what I would say is, even if it's not 2020, the moment you realize that you're getting uncomfortable, stand up, walk around, interact with. Somebody had given a proposition that, we pick, I can't remember, it seems like an average Nigerian answers call for like 30 minutes a day, 30 minutes to 1 hour. And he says that if anytime your phone rings, you stand up to walk around and pick your phone, you realize you have exercised yourself for 1 hour. So those are the things we can do. And then the kind of chair you're using, I'm sure the chair is comfortable, your feet is touching the floor. You have good back rest and neck rest as you're walking. All these things put together, the person will do better.
Okay. All right. We still have a few minutes before we go on break. Now, let me ask this question. Does your phone quality have anything to do with the vision of your eye? Because, things are hard now. People go for cheap phones and all that. Does it have anything to do with
it depends
the resolution of your phone? Does it have anything to do with the eye?
Yes, because with every quality, the resolution varies. Yes. So, but what I would tell the person is that most phones I've seen, even the cheap ones, they have the eye care mode. Okay. Just use it. Use the eye care mode. And if you cannot afford a phone that has nothing, you can go the extra mile. I've seen many young people come to me now and say, sir, I don't really have an eye problem, but I want something to shield my eye when I'm using my system. So I need a blue cut lenses and photochromic lenses, and it's highly encouraged. So you can go and get a blue cut lenses to shield your eye while using your phone. Okay. So it helps also.
All right. Thank you so much, Doctor. We'll go on a very quick break to give our guests a little breather, and we'll be right back. Stay with us.